I typically recommend the implantation of a penile prosthesis to a man who is not able to obtain a satisfactory natural erection. I do personally in my practice prefer men to be able to obtain an erection that is a blood flow erection, but many men cannot tolerate therapies that give them a blood flow erection, or those therapies are ineffective. And when that is the case, the 3-piece inflatable penile prosthesis gives the greatest satisfaction rates and works beautifully for a man to obtain an on-demand erection as long as he wants, whenever he wants. So during the procedure, the patient is completely asleep under general anesthesia. A urinary catheter is placed, a small incision is made underneath the penis. We then open up the erection chamber where blood flow used to occur. We dilate that chamber and measure so that we can insert the balloons appropriately sized for that man. Once those balloons are ready, we place them. We also put a pump into the scrotum, and we pass a small reservoir balloon through that same incision into the groin behind the pubic bone. At that point in time, all the tubes are connected and the incision is closed with a dissolvable stitch that does not require removal. Typically for my patients, we will leave a urinary catheter in overnight, and that will be removed the following morning in the office. The surgery is performed most often as an outpatient. The surgery takes typically less than 1 hour time, and a stay in the recovery room is usually 1 to 2 hours. Most patients do not need any official clearance for surgery as long as an anesthesiologist is comfortable with their risk of general anesthesia. For my patients with medical issues, we will get an internist to clear them for the procedure, and anyone with any previous cardiologic history or neurologic history, we obtain an appropriate clearance to make sure they're safe. Since this procedure is performed under general anesthesia, everyone will require transportation to and from the procedure. We will give instructions as to appropriate hygiene and bathing habits for the time of the procedure. We will also provide medications for post-operative care, but we typically will write those at or before the time of the procedure so you can have those on hand beforehand. Blood thinning agents are held before the procedure. If these are prescribed by another physician, we obtain clearance for that physician for the appropriate time frame of blood thinners to be held. Other than that, typical medications are continued up to the time of the procedure, with a few different blood pressure medications and others held the day of, depending on the preference of the anesthesiologist. Because of risks of general anesthesia, patients are asked not to eat or drink anything after midnight before the procedure. But there are no eating restrictions post-operatively, and up to the day before the surgery, there are no eating restrictions either. Since this is an outpatient procedure, one gets to leave in the clothes that they came in when they're discharged from the recovery area. We do recommend loose-fitting sweatpant-like clothing given a new surgery down in that region. Shaving is recommended before the surgery, but not the day of the surgery. If someone is to self-groom, we recommend that be performed approximately 3 days or more before the procedure. If one does not self-groom, they will be shaved on the operating table by the surgical staff. Typically on the day of surgery, a patient is asked to show up about 2 hours before the planned surgical time. At that point in time, they'll meet with preoperative nursing. They will sign a surgical consent form, have an IV placed, and then move to a secondary preoperative area where they will meet with the anesthesiology service, answer questions from them, and sign an anesthesia consent form. At that point in time, they'll proceed back to the operating room where the 1 hour or less surgery will take place. They will then proceed to recovery, and in 2 different phases of recovery over about 2 hours, they'll eventually be discharged. Typically, the entire experience takes about 5 hours of time. Being nervous about having surgery is a very normal reaction. Our goal is to try to support any patient having an operation through the entire surgical process. Sometimes being nervous relates only to the surgery itself or the risks of general anesthesia, in which case we are well versed to answer questions and help reassure patients or connect them with an anesthesiologist who can help them as well. Other times that nervousness relates to the penile prosthesis itself, and we can easily connect any patient with a patient educator, someone who possibly has had the device implanted on themselves or has great experience with it to help alleviate these concerns. At any point in time, a patient pre or post-operatively can contact my office with questions about the surgery, and be connected with my surgery scheduling staff.